Best treatment option for sulcus vergature is A. Excision of vergature, B. Bilateral medialization procedure, C. Mucosal resection over sulcus, D. Voice therapy alone is always difficult. Answer of this question is B. Bilateral medialization procedure. As sulcus vergature may be best treated by bilateral medialization procedure rather than attempted resection of the vergature, which is technically extremely difficult, or you may damage the ligament and that may lead to scarring. So best option is medialization procedure. So now, what is sulcus vocalis? Sulcus vocalis is a longitudinal furrow or groove along the edge of the vocal fold resulting from loss or thinning of the superficial layer of lamina propria. It leads to impaired vibratory function of the vocal fold. So it is a localized invagination of the mucosa of varying depth. Before going into the classification of sulcus vocalis, it's necessary to recap the anatomy. What is body cover theory? Body is made by the vocalis muscle and cover is made by the this epithelium and lamina propria. So there are layer is epithelium, superficial lamina propria, intermediate lamina propria, deep lamina propria, and last is the vocalis muscle. So most important for vibration is the epithelium and superficial lamina propria. That is the main cover of the this vocal folds. That below this, between the superficial lamina and intermediate lamina is the Reinke space. So this epithelium and superficial lamina is more in the vibration field. In sulcus vocalis, the superficial lamina propria is thinned, fibrotic or absent, leading to tethering the mucosa to the deeper layer. That may lead to this sulcus formation, means pit formation in the vocal fold. Etiology of sulcus vocalis are congenital. It is maybe because of failure of normal development, possibly due to fourth or sixth branchial arch anomaly. Acquired may be phonotrauma, iatrogenic after surgery or intubation, post-inflammatory or degenerative changes, and that may be associated with cyst rupture. If cyst rupture, there will be pit formation. So these are the possible causes. Clinical features are dysphonia, hoarseness, breathiness, loss of volume, vocal fatigue, diplophonia, reduced pitch range, breathy, weak voice are the common symptoms. Ford classify this sulcus vocalis into three parts. Type 1 is physiological sulcus. This is superficial longitudinal depression of the epithelium not beyond the superficial lamina propria. The vocal ligament is not involved in type 1. Video laryngostroboscopy may only show mild mucosal wave abnormality and voice is not affected significantly. Treatment of this should be conservative with speech therapy, sometimes anti-reflex therapy. Type 2A sulcus vocalis is the sulcus vergature. That question was on sulcus vergature. This is more extensive invagination extending into the vocal ligament with some loss of superficial lamina propria. Linkage space exists supralaterally and infromedially to the vergature. They are thought to result from congenital failure of development of linkage space as they are commonly apparent at puberty and can be familial. There is moderate mucosal abnormality on video laryngostroboscopy and may have moderate dysphonia. Sulcus vergature may be best treated by bilateral medialization procedures rather than attempted resection of the vergature, which is technically extremely difficult. Type 2B classical sulcus vocalis or pouch type. This is characterized by focal pit that extend beyond the vocal ligament into the thyroerytron muscle. This is marked loss of superficial lamina propria, leading to significant mucosal wave abnormality in laryngostroboscopy. That may having the loss of vibration and patient present with severe dysphonia. You can see this picture, this dip is going on up to the vocalis muscle. So this is the type 2B. Sometimes this sulcus vocalis may rupture and go through and through from superficial to deeper aspect of this sulci, leading to tubed pedicle formation, that is mucosal bridge. The treatment of sulcus vocalis is difficult and results are variable. If surgical treatment is required for sulcus vocalis, careful dissection of the pocket of the ligament is required. The difficulty is defining the plane between the base of the sulcus and the ligament and avoid excessive resection of the mucosa and damage to the ligament. Sulcus vergature may be best treated by bilateral medialization procedures rather than attempted resection of vergature, which is technically extremely difficult. The ongoing challenge in the management of sulcus is that no single treatment modality is superior to others and no sufficient evidence for matching a given treatment to a given patient is yet available.